Let me start with something most people don't realize. Some of the foods you eat every day, even the healthy ones, can quietly interfere with your blood pressure medications, okay? Not because you are doing anything wrong, but because no one ever warned you. Welcome back. My name is Nicholas. I am a pharmacy practitioner. If you are an older adult taking blood pressure pills, this conversation is worth having, okay? Medication doesn't work in isolation. It works inside a real body that eats real foods, okay? Today, we are talking about foods that can weaken, boost, or clash with blood pressure medications and how to eat smarter without giving up your joy, okay? So I will not instill fear in you. I will not shame you, but I'll just clarify everything, okay? Well, let us start with the famous culprit, that is grapefruit and grapefruit juice, which can interfere with how your body processes certain blood pressure medications, okay? I want you to think of your liver like a traffic controller. So when grapefruit steps in and says, hold up, everything slows down. That can cause medication levels to rise too high in your blood, which leads to dizziness, weakness, or even low blood pressure, okay? And here's the tricky part. Even just one glass can matter for some people. So, if grapefruit is part of your routine, it's worth asking questions, okay? So number two, please note that salt isn't just the shaker. Most people think that salt only comes from the salt shaker. Let's be real, it mostly comes from the packaged foods, okay? This include canned soups, breads, processed meats, sauces, and seasonings, okay? Too much salt can fight against your medications like two people pulling a rope in an opposite direction, okay? This is where the pills try to lower your blood pressure, but salt quietly pushes it back. You don't need to eliminate salt, you just need to be aware of where it lies so that you may avoid it easily, okay? Number three, licorice. This one surprises almost everyone, okay? I mean the real licorice, not the candy flavored one, okay? This one can raise blood pressure and reduce the effectiveness of some medications, okay? It can also cause potassium levels to drop, which affects your heart. So licorice teas, herbal blends, and certain supplements are often the hidden sources. So natural doesn't always mean neutral. So number four, potassium-rich foods. Are they helpful or harmful? So foods like bananas, oranges, tomatoes, and potatoes are often praised, and rightly so. But here's where the nuisance matters, okay? Some blood pressure medications increase potassium levels in your body. So when you add large amounts of potassium-rich foods or supplements, they can push levels too high, okay? So think of potassium like seasoning. A little enhances the meal, but too much throws off everything, okay? So balance matters, especially when the kidneys are aging. Number five is alcohol and timing. Alcohol doesn't just relax the mind, it relaxes blood vessels. So when you combine it with blood pressure pills, that relaxation can be too strong, which results to sudden drops in blood pressure, dizziness, and increased fall risk. So when you drink in the evening, it can also disrupt nighttime blood pressure patterns, okay? This isn't about just judgment, it's about timing and moderation. Number six, supplements and health foods. Garlic pills, ginseng, St. John's wort, high-dose magnesium. These can interact with blood pressure medications in unpredictable ways. So supplements don't go through the same checks as medication. So your doctor may not know you are taking them unless you say something about them. Your food and supplement list is part of your treatment. So here is the big realization. If your blood pressure feels unpredictable, it may not be the medication failing, it may be the food medicine conversion that never happened, okay? Food can amplify, cancel, or distort how pills work, especially in older adults. This isn't about restriction, it's about coordination, okay? So here is your calm takeaway. You don't need a perfect diet, you need an informed diet. Pay attention to patterns, notice how you feel after certain foods, and bring food and supplements into conversion every time. If this helped you see your plate differently, share it with someone managing blood pressure too, okay? And if you want clear practical guidance that respect real life, subscribe and stay with me. Because the best medicine works with your lifestyle, not against it, okay? Be blessed.